a cikin dai the whole hospital. To yau mun kawo shi a cikin gida yazo muna karin bayani kan shi wannan diagnostic center nan. Muna tare da Dr. Salifu Mutawakkil, shike in charge of the diagnostic center. Sai zai ba mu karin labari, amma za mu yi da turanci ne. Zan yi kokari dai in yi fassara a Hausa saboda masu gida kuma masu kallo daga gida ku gamsu da abin da muke cewa. Doc, good morning. Welcome to TSARIN SAFIYA on BEIN TV.
Thank you.
And you're saying it's your first time on TV, so it's good. Don't worry. Don't worry. I will deflower you this morning.
Sure.
Doc, can you please tell us something small about the diagnostic center?
Yes. Good morning once again, and thank you for having me. Yes. You know, when every patient goes to the hospital, before even they talk to the receptionist, there is one thing they have already given the hospital, and that is trust.
Okay.
Every patient trusts that the moment they walk into the hospital, everything that is wrong with them or anything that has brought them into the hospital, they will walk out different how they came in. So that shift from going to the hospital, being sick, and then the right diagnosis being made and the right prescription being given to treat that disease is where the diagnostic center comes in. So what we do at the diagnostic center is that we make sure that every patient that comes inside, whatever that is wrong with the patient, the right diagnosis is made. Because there is a difference between having a particular symptom. In our local setting here, we have this perception that whenever I have a headache, it's malaria. Whenever,
the usual suspect.
Yes. Whenever I have stomach ache, I have ulcer. But what makes it different is when you come to the hospital, all these things we have to confirm. You come with your symptoms and the right diagnosis has to be made. So at Islamic Diagnostic Center, what we do is we make sure that the right diagnosis is made on all the different cadres of health system.
Okay. All right. Okay, now you've told us generally what it's all about, but I want to know the particular services you provide at the diagnostic centers.
Okay. When you look at the laboratory system, it's grouped into various departments. We have the hematology department.
What's that?
That is where we deal with, when you go to the hospital, normally they will ask you to bring a blood sample. We run a full blood count. Yes, we run a full blood count. We can do a blood film for malaria parasite and all that. Yes, those fall under the hematology category. Yes, so we have the chemical pathology too. That is where we do the liver function test, the kidney function test, and iron studies, all various other tests to make sure that all systems in your body is functioning well. And then we have the immunology department. That is where we diagnose certain conditions such as hepatitis, HIV, and all those immunological conditions. And then aside that, we have the microbiology department. That is where we deal with microorganisms. When you go to the hospital, sometimes you are asked to bring urine. You are asked to bring stool. Yes, for culture and then for microscopy. That is where all those diagnoses are made. But at Accra, at Islamic Diagnostic Center, we do all the services. Yes.
Okay. All right. So, what is your turnaround time?
When the issue of turnaround time is actually test specific. Yes. So, but we have certain generals that when you come to the lab, there is something we call routine test that they normally come in on a daily basis. Something like full blood count. It comes on a routine basis. So those tests, normally the turnaround time doesn't exceed 2 hours for the chemistries, hematologies, and all that. But if we are dealing with the microbiology aspect, those tests, especially culture and all those things, sometimes they take longer.
Okay.
They can take up to 72 hours to be ready.
Oh, okay.
Yes, please.
All right. Usually, because I know malaria is around 1.5 hours.
Yes.
I know. Oh, so that's okay. But do you does someone have to be admitted inside a hospital before they can access the diagnosis center, or I can just decide to walk in and then have access to it?
The diagnostic center is open to everybody.
Everybody, okay.
Yes. It's for inpatients, it's for outpatients as well. So there are some patients, sometimes you go to smaller facilities, clinics, or even sometimes hospitals, and then you are asked to run certain tests. But the particular place you went, they don't run those tests there. So at Islamic Diagnostic Center, you can come in at any time. There are some people that can just walk in for checkup.
Okay.
We offer all those services. Yes,
okay.
please.
I know some labs in the country they offer home services. Do you guys do that, or because you're new, you're still working on that?
Currently, we have systems in place to implement the home service. Yes, it's something that we will run. Yes, whenever you call any of our numbers, we have people that are ready that will be deployed to your location. Okay. Because one thing about the diagnostic system is that the sample that comes in is what represents you, the patient. Because we don't get to see the patient much. Okay. So there is this thing we say, garbage in, garbage out. So we send people around to get the sample for us, like well-trained people, to give us the sample in the right container. Okay. Yes, and all that before we run those tests on them. Oh, okay. Yes.
So you spoke about the turnaround time in 42 hours, 72 hours and thereabouts. So, like, for instance, I walk in and I'm like, oh, I'm going to check on something and I'll be back, and I'm not able to come back. Like, how do I get my test? Do I still have to come back and pick it, or you can mail me the results or send it to me via social, like, I don't know, via something, either email or WhatsApp or something, or I have to pick it up myself?
We can, when you come to the hospital, some of the information we take your phone number, we take all those information. So you have a case, you see, most of the health systems currently are moving on to the paperless system.
Okay, okay.
Yes. Yeah. So at our place like this, it's a paperless system. But you have some patients that even after everything, they've seen the clinician and all that, they still want their results. Okay. If you want, it can be mailed to you. If you want, it can be printed, validated for you to pick it up yourself. So depending on whichever platform or whichever way you might want your results, there are available means by which you can get them.
Okay.
Yes.
Oh, so let's say I just walk in for some lab test or some, I don't know, how do you mention those things, and then I get a result. Like, so what happens after that? Do you try, because you run a hospital as well, do you try to woo me that, oh, you have the best services to attend to me, or you just give me my test and let me just go to wherever I want to go to?
It depends on the kind of request you brought in. Okay. Because just as I said initially, there are some people, they are already seeing a particular clinician at a particular hospital. So they come in with a request because that particular test is not done at that facility. Okay. But if we are talking about a case of somebody coming in for a general checkup, because you can be healthy, but you go in for a checkup, and then the results that will come out, there will be an indication of something going wrong. In a situation like this, what we will do is we will try to recommend our services to you, because we have competent clinicians at hand to handle whichever situation that might pop up. So we will give you that option, that there are people around you can see and talk to.
Okay.
Yes.
Now we've talked about the services you render, how accessible it is. Now we are going to talk about the most important part, the money. How affordable is your services? We know these services don't come cheap. So I don't know, because you guys are in the Zongo community, a Muslim community, how affordable are your services?
At Islamic Diagnostic Center, what I can assure the viewers is that it's one of the most affordable you come across currently. Judging by the quality of service that we are providing, and by being in the system for some time now, I've worked in so many places, and I know how much some tests are going and the machines that are being used. And if you look at Islamic Diagnostic Center, for instance, we are, for our chemistry machine, we are using the BC600M from Mindray, which is the first in West Africa here.
Oh, okay.
Yes.
That's nice.
From Mindray, which is a very quality machine, runs all the tests with accuracy and precision. And the amount of money we are charging for it is far less than you find anywhere. Okay. And we accept insurance too.
Oh, okay. I was about to ask about it.
Yes, we accept insurance too. Okay. And our tests are very, very, very affordable. Very, very affordable.
Very affordable.
Yes.
So can you give me any contact number? We know it's a new town, or any social media handles, because now, like you said, everything is going paperless, digital. Yes. We are going digital, so you should be active on social media.
Yes.
So do you have any social media?
Yes,
handles?
we have our website. Okay. And then there are numbers that I'm sure after the program it will be made available, that we can be contacted at any time at all. We, just as we said earlier, we run home service and anything. There are people that sometimes they don't get the chance to maybe say they want to come to the hospital. Don't worry. You give us your location. We will come, pick the sample ourselves, and then provide every service you need for you.
Okay, all right. So I think you've already answered most of the questions. I had follow-up questions, but in the course of the questions, answering the question, you already answered I was about to ask of the machines, and then you made mentions of the ones you have. So do you have any final words for your viewers, and tell them, like, sell Islamic Diagnostic Center to them so that they can come and experience the best of services that you guys have?
We know that laboratory service or diagnostic service, it's a very essential part of healthcare delivery. And anything that comes out of the lab is what your treatment plan will be based on. So insist on quality. And if you want quality, I can assure you there is no better place you can go to currently than Islamic Diagnostic Center. Okay, don't worry. We'll come and have a try, and then we'll try and test, and then we'll come and tell our viewers as well. Thank you very much, Dr. Mutawakkil Ismail, for, I hope I got the name right. Salifu Mutawakkil. I'm sorry, I beg your pardon. Salifu Mutawakkil, for coming in this morning to talk about the Islamic Diagnostic Center. Let me quickly try and summarize what you said in Hausa to the viewers. Thomas Kallo, wannan likita ne daga Islamic Diagnostic Center da ke Newtown Islamic Hospital da ke Newtown, sun bude sabon lab ne da ke wurin. Zaka iya shigowa ko ka zo asibiti daga wurin, ko kuma ka zo musamman ka zo maybe ka je wani wuri aka rubuta maka wani test kai, zaka iya zuwa wurin su yi maka. Wai suna da machines daban-daban da aka kawo. Wani machine ma da ya kira sunan shi is one in few in West Africa. Suna da shi daga wurin su, yana gano ciwo daban-daban, suna da abubuwa daban-daban da suke yi. Yasa ya kamata instead dai ka je nisa, ka je cikin gari, tunda dai wannan ya zo yana kusa da mu cikin Zongo, ku zo kowane test da kuke so ku yi, kowane dubi. Suna duban kidney, suna duban wurin kidney, liver, duka suna da machines da ke yin wa'annan abubuwan duka. Kuma wai gaskiya services suna da sauki sosai, farashin na ƙasa, kuma suna karban health insurance. Yasa kakku waiwaye kowane wuri duka, kakku duba ko ina kamata ku zo. Wannan abu namu ne na musulunci na cikin Zongo, dan so tari da yawa muna kuka cewa ba mu da irin wayannan abubuwa na musulmai. To wannan ya zo namu na musulmai ne da ya kamata ku ringa kokari muna zuwa mu je wurin mu mara mishi baya. In ba mu musulmai mu za mu mara wa baya ba wanda zai. Yasa saboda mu aka kawo wannan, yasa ku yi kokari wanda suke karkaran Newtown, Mamobi, Nima, kai ko ina ka fito, ko Madina ma zaka iya shiga mota ka je
Islamic Diagnostic Center kenan suna komai duka wai suna yin ma home service maybe dai kana jin kiwiyan zuwa wurin zaka yi kai kira a number da ke kan screen mu nan shi number sun su kenan za ku yi ku kira su in kana son home service ne an zo gidanka a zo a dauki samples ka a zo a in results ya ready anya kuma a sake kawo maka shi ko a turo maka shi via email kenan yasa wai duka wayannan abubuwan yana suna yin wayan abubuwan da yake sai kokari ku kama a kuna ganin muna nuna muku wato tallan su akan nan wurin tashar mu na BEIN TV yasa abubuwan da suke kina numbers sun ke kan screen ku da kuke gani yanzu za ku iya kira an kana da wani tambaya kana da wani karin bayani za a tambaye maka test da kake so kai duka suna yi da abin da ka je cikin gari kana gajiya wannan gwara ka zo nan kusa ka zo kai muna ka je wurin a yi maka abin da ya kamata a yi maka kenan to Islamic Diagnosis Center yana Newtown na san da yawa mutane da yawa sun san inda yake yasa shi muka zo muka yi magana da su da safe nan inda Dr. Mutawakkil ya zo yi muna karin bayani Dr. Salifu Mutawakkil ya zo yi muna karin bayani yasa ku yi kokari ku je Islamic Diagnosis Center ina so a ringa ba mu reviews in kuka je kuma in daga nan BEIN TV kuka ga wannan talla kuka je mention BEIN TV maybe me yiwa za ya ba ku wani special discount ne nake cewa to masu kallo ina ga nan za mu kawo karshen shi wannan interview da doctor da shigo mana cikin gida doctor thank you very much. I think I've tried. You're with your 3% Hausa. I hope you understood what I said.
Yes.
Okay, so I tried to summarize everything for them. The numbers are on the screen. I've told them if they have any questions or somebody that wants your services, they can give you guys a call. Thank you very much this morning. I know you had to squeeze time out of your busy schedules, plus Ramadan and a whole lot. Thank you very much. So I hope I'll come around myself to have a look. Okay, so ina ga nan zamu kawo muku karshen wannan interview da muka kawo. Up next is the political segment da masu yan siyasa a cikin gida ku saurare mu samu zagaya mu dawo.